We are back again with nephrologist Dr. Arijit Chakravarti from Lourdes Medical Center. Now, we've gone through a lot of the symptoms of kidney disease. Now, let's just imagine that a patient is diagnosed with kidney disease. What are then the first steps? What happens?
So this is very, very important. And you know, again, kidney disease, although it's not well known, it probably is very prevalent. We think that it's maybe even 10% of the population, the United States population, has kidney disease, and is most commonly diagnosed by a primary care physician. So a primary care doctor or a family doctor is an imperative part of screening for kidney disease and diagnosing kidney disease. When there are stages of kidney disease, and it kind of correlates with the symptoms that we were talking about. But if someone does have chronic kidney disease, and the most common reason in the United States is if someone also has diabetes, they may have stage 1 chronic kidney disease, which is that their kidney is still filtering at more than 90 milliliters per minute. That's stage 1 chronic kidney disease. Once someone has developed worsening kidney function, and their kidney function is less than, say, 60 milliliters per minute, or how fast the kidneys are filtering blood, that usually is that stage 3 chronic kidney disease, and that's when a primary care doctor or a family doctor will also refer the patient to a specialist, a nephrologist such as myself, or a primary nephrologist. Unfortunately, if someone develops kidney disease, there really is no known cure. Someday maybe there will be, and there's hope for this. But we shouldn't despair that there's no cure. We've known this for years and years. The most important thing is that we can help people live longer with kidney disease. We slow down the progression of kidney disease by treating diabetes and hypertension. But if the kidney disease continues to worsen and patients continue to develop some of those late symptoms, they may actually have then developed stage 5 kidney disease, which is usually that the filtration rate is less than 15 milliliters per minute. Again, how fast is filtering blood?
So then what's the protocol?
So at that point, unfortunately, then a person, actually even worldwide, but certainly here in the US, if someone has stage 5 chronic kidney disease, they have two options. There's treatment options include dialysis or transplant. It's important then for a nephrologist to then refer the patient to someone such as myself, as a transplant nephrologist or a transplant surgeon, either. But the patient gets referred to a transplant center, and they get evaluated for kidney transplant.
And that's while they're on dialysis?
That can actually even be before they start dialysis.
Okay.
And this is an important point you make.
That's interesting, because I always was under the impression that you are on dialysis first, and then you go for the transplant. But you're saying that it could be one or the other.
It doesn't have to be that way,
okay.
yeah. And in fact, probably in the past, kidney transplantation has been done since the 1970s. Probably in the past 20 years now, what we call preemptive kidney transplant is being done more often. It's also, we should keep in mind, kidney and pancreas transplant can also be done preemptively. We think that the earlier someone gets transplanted, the better they may do after transplantation. Now, there's an important thing to keep in mind, that dialysis is not bad. I'm a nephrologist, so I can do dialysis, but my main job is transplantation. And what that means is that it's my job to figure out who needs a kidney or a pancreas and who can donate. If someone needs dialysis, dialysis is life-saving. Without dialysis, people would die.
Right.
But what we have learned the past 20 years is that the longer someone is on dialysis, there's some long-term effects that don't get reversed even after transplantation. And what this means is that if someone gets transplanted and they've never had dialysis, or say if they've had less than 6 months of dialysis, they can do very, very well. As compared to, say, if someone's had dialysis more than a year, or especially if someone's had dialysis more than 3 years, even after they get a transplant, they may not do as well as compared to someone who has never needed dialysis and has gotten a transplant.
So who can receive a transplant?
So if any, the most important things are that someone has to have chronic kidney disease.
Right.
We've started to learn more recently, again in the past decade, that acute kidney injury or acute kidney disease is also very, very important. Acute means that there's been some kind of injury to the kidneys, but that it is reversible, and then the kidney function can improve again. But we've started to realize that the more often someone has some of these acute events, that they may have long-term effects, meaning that some patients do develop chronic kidney disease if they've had repeat episodes of acute injury. or if they have slowly developed chronic kidney disease. And once their kidney function is less than 15 milliliters per minute, or usually if they have
And when you say 15 milliliters
Yeah.
per minute, that means
or,
the
you
blood.
know, or a common way that that doctors even explain and patients understand is percentage. Less than 15% kidney function or less than 10% kidney function.
Okay.
But we should keep in mind, and patients have actually become more savvy these days. They know blood pressure, they know systolic blood pressure and diastolic blood pressure.
And you can always look it up on the
Yes,
internet, right?
and so really what doctors talk about, other specialists, family doctors as well as kidney doctors, is GFR, which is the filtration rate. And so when we say 15%, what we really mean is how fast the kidneys are filtering blood. Normally, an adult with 2 kidneys is filtering blood around 110, 120 milliliters per minute, every minute.
Got it.
And once it's less than 15, the disease has progressed far.
Makes sense. Coming up, Lourdes Medical Center is putting the spotlight on organ donation. How? We'll explain after the break.